Go.
Hi, John. I'm Bailey. I'm going to be your nurse today. How are you doing? Good. Can I have your name and date of birth? Perfect. And do you have any allergies? Okay, awesome. I'm just going to get this in privacy, and I'm going to look in your chart real quick to see what we have going on. Okay, it looks like we need to change your CVAD dressing today, the doctor ordered. Have you had that before? No? Okay, so I'm just going to explain it. So CVAD dressing, so CVAD is that tube that goes straight to your heart, okay? So we want to keep it as clean and sterile as possible, because if an infection were to get in it, it would go straight to the bloodstream, and that's not good. So we change it about every 5 to 7 days, but also depending on how it looks, if it isn't clean, if maybe the edges are torn a little bit, or if you have like a fever or something and we suspect an infection, we'll change it. So is that okay if I change it today? Okay, perfect. And do you have any questions? Okay, awesome. Is it okay if I lift your gown down a little bit so that I can look at the site? Okay, awesome. So we're just gonna look at it. Okay, well, it looks like there's no redness, no swelling, and no drainage. See the catheter length, so I'm gonna note the catheter length. And looks like the edges are a little torn, so we are gonna want to switch it. But besides that, everything looks fine. No redness, no swelling, and no drainage. Okay, so I'm gonna keep this open, is that okay? Okay, perfect. And I'm gonna take it off. So I'm going to switch my gloves. And when we do this, it's a sterile procedure. We wanna make sure that there's no bacteria or infection getting on it. So I'm gonna put on a mask, and I'm gonna have you wear a mask as well. And I'm gonna have you turn your head to the side. And neither of us are gonna talk. We're gonna try not to cough or anything so that no bacteria or anything gets on the site. Is that okay? Okay, perfect. Hand hygiene.
Oh, hand hygiene. Sorry, she did hand hygiene.
Yeah, hand hygiene. I did that. And then I have my mask on. I'm gonna put my patient mask on. Here, this is for you.
Yeah, we'll see if I pass American Heritage. Oh, that's annoying. I'm so jealous. I rang the bell, but I didn't. I just wanted to see what it sounds like.
So I'm going to take this off from distal to proximal, going in the direction of the catheter. Off. Be situated how I want. Hand hygiene again. Making sure I don't have any rings or anything on my arms. I take my kit, open it. Also, a lot of times, this Tegaderm won't be in there. It'd be in a separate kit, so I would just plop it on top. But it is in there. So. So I'm gonna put my hands in the sterile part and bring it over here. And this kit should have had a sterile gauze in it. So I'm going to time out the video. Okay, so then I'm gonna take my alcohol swabs. So I didn't have a sterile gauze before, but now I do. So I saw some dried blood on it before, so that's why I'm gonna take this alcohol swab. You can use 1 to 3 of these. I'm just gonna use 1 because it was just a little bit of dried blood. Take this sterile gauze and lift up the tubing, and I'm gonna go from the inside or closest to the outside. That way. Then I'll take the chlorhexidine, I'd pop it, and I'm gonna do this for 30 seconds. And I'm gonna make sure to get all around it and including the hub. So this is going for, now it's been about 5 seconds, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23. Oh, there was a timer and I was counting too slow. It has been 30 seconds according to the timer that I had. So now I'm going to put it down and I can throw these away. I could put on skin prep as well, but I'm gonna make sure that I let it dry. So it's drying, and then I'm gonna take my Tegaderm. So typically the Tegaderm has a square right here. I'm gonna make sure that the square goes right above the hub. Okay, so square goes right above the hub. And you press it down. Make sure that everything looks good. Okay. Then I have the label. And I'm gonna initial it. I'm gonna put my initials, the time, and the date. And I'm gonna make sure that it's not on or above the hub. So I'm gonna put it right here on the side. I'm gonna take a little bit more tape. And I'm gonna put it underneath to secure it. Secured. Then I'll put this back up and I'll note the catheter length again, that it's still the same length. Okay, I'll clean up everything. Okay, how was that? Good. How are you feeling? Awesome. Do you have any questions? Okay, perfect. So we're gonna open this back up. I can take my mask off, and we'll take your mask off. And I'm gonna do hand hygiene. Okay, yay, I'm glad everything is feeling good. If you do have any questions in the future, please let me know. Here's your call light so you can call me. If you have any, if you are feeling like you have a fever or itchy or kind of the chills, make sure to let us know, as that could be a sign of an infection or even an allergic reaction to the dressing. So if you were in bed, I would put the pillow back behind your head, and I would put the side rails up and lock the wheels, but since you're in this, I'm gonna lock the wheels here, which is good. And are you sure you want to stay in the chair? Yes? Okay, because if you didn't, I could put you back in the bed. Perfect. So now I'm gonna go document. So I'll leave the room and I'll hand hygiene, and then I'm gonna document. So things I'm gonna document is the drainage and the redness, and if there's swelling. There wasn't any of that, but I would document that. I would also document any questions the patient had, the patient's consent, the patient's response afterwards, and also my teaching, what I taught. I would document that I did the change, and I would say the materials that I used. For instance, what kind of tegaderm I used, and I would also, once again, put the safety down. So I would say that I give them their call light and safety times 4.